Hello, you beautiful people. It is another incredible Medshield Movement Connect show episode with me, Dr. Fez. Now, we're going to be unpacking a lot of very interesting health issues per the Healthcare Awareness Calendar. And this month is September, so we're going to be speaking to an optometrist who's going to answer all the questions you probably have and also tell us some of the myths, because we don't want none of that.
Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. Fez Mkhize, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect show. Let's go.
Luke, thank you so much for sitting down with us.
Yeah, it's a pleasure to be here, man.
So I know a lot of people tend to think optometrists are just about getting glasses or just about seeing how far you can see things, but what would you describe or how would you describe an optometrist's role in the medical scheme?
I think primary healthcare, obviously ocular is the first part of it, but primary healthcare. So we've got to make sure that we're doing a full holistic treatment of that patient that comes into our room, and I think that's a major benefit, you know. The eyes are the windows to the soul, and one of the big things is that we can actually see the vascularization in the eye, and it's one of the few parts of the body that we can actually see it. So making sure that we're doing full healthcare checkup from the ocular side in terms of health, anterior and posterior, and then focusing on the glasses. I think a lot of optometry, the main focus is just how do we sell a pair of glasses or how do we get people into glasses, where the major thing is actually the health side of it. You know, silent killers like glaucoma and that sort of stuff, but also the systemic health side is a big part that we can assist in co-managing patients.
Definitely.
You know, I think that's a big part.
Definitely, and I think especially in the time we live in, we're not putting people into cubicles or compartmentalizing things. We are looking at holistic views when it comes to health. In your perspective, how often should somebody be coming to see an optometrist? Because people are always like, only if I'm starting to maybe not see quite well, or only if I feel like, okay, I'm getting blind in certain places, I need to go see somebody. What would you say would be trigger points or signs that you might want to see somebody, or just how many times in your lifespan should you have at least seen an optometrist?
I think the first myth is that we see the world the way we're meant to see it. Yeah. So if you haven't done a test, you should be doing a test. Yeah. Other than that, you know, it depends on your health. So if you're a kid, we like before the age of 4 or 7 is really important. So we call it the development phase of 7. After that, they usually talk about the channels being locked up. So people with amblyopia and all that sort of stuff, which is a lazy eye, an eye that's not working. You know, not many people are playing pirates. You know, so they don't realize that one of their eyes aren't working and not. So that age of 7 is important, and there is a lot of people that are offering free kid screenings, and so we'll use that and utilize that as much as possible. A lot of optometrists will help with that. Then after that, you get your sort of 12-year-old who should have come at least for one test, because now you're going into high school and they find that's where a lot of the short-sightedness starts to show up. And then after that, it's once every 2 years, once every 18 months is kind of good, depending on whether you're on myopia control, which we could maybe talk about later or not. And then after that, it's systemic health. So if you are healthy, once every 2 years. If you're not healthy, it can be once every 3 months. Okay. So that's where that variation and that changes, and that's important. So health-wise really controls how often you need it, or the progression of your eyes relates how much you need to use it.
Speaking on that, because you are talking about myopia, if you could just give a quick kind of definition of what it is and why it is that you actually have to come in and get that kind of checked.
So myopia control is short-sightedness, so someone that can see close but they can't see far. It's generally the major thing, and it's a global phenomenon. So, for example, in Japan, they're looking at like 60 to 70% of the population having it by 2030 or 2040. I think the stat was released, so don't quote me too well. Recheck the stats, but it's actually it's crippling their health system because there's so much focus on that, right? So there's a new thing called myopia control, where you can actually help prevent the movement. So the research has gone and saying, well, why are these kids or why are these people continuing to get more and more and more and worse and worse and worse once we're correcting the vision? So the science around it is basically now trying to prevent that movement. So there's ways now to us to say, okay, well, you're a -1, which is not so bad. How do we stop you to getting to a -7? And when you get to a -7, your risk of retinal detachment, your risk of blindness, your risk of non-preventable blindness drastically increases. So again, if you can prevent that and you can stop that, glasses can't fix those things that it causes. They can fix your sight, but it can't fix the secondary health problems that it causes. So the major focus is trying to limit that and prevent that. So that we actually see our patients, it starts off with like a 2-week cycle, a 3-week cycle, 6 months, 6 months, 6 months, 6 months, and then we don't get progression, then it will stretch out to a year to 2 years once we don't have any progression in the eye.
Nice. I mean, I always love hearing prevention because I'm always the person who advocates for that. Of course, people get ill and you want to treat those things, but you always want somebody to be optimized. You want somebody to live a life where he's actually going for the best, not trying to get the bare minimum. I've seen a couple of discussion points. People like Professor Andrew Huberman, people talk about exercising your eyes as like a form of potentially preventing fallout or issues with eye care or eye health in the future. Are there such things where you can kind of have exercises where you can improve or kind of prevent deterioration when it comes to eye health?
I think first things first is getting some time outside. So 2 hours a day outside, they talk about for youth. Again, everything's very much kid or child orientated in terms of the adolescent phases. In terms of ocular movements, the big problem is presbyopia. That's what everyone wants to try and avoid. And presbyopia is the loss of near vision, the inability to see close as you age. So that particular...
I love the vernac, by the way. Yeah.
So that particular change, so as that change occurs, that's what everyone wants to try and prevent. And unfortunately, as it stands, that comes for a lot of people, and there's nothing we can really do about it. So I don't know if there's an industry hidden secret, something that they're trying to hide from us that we can't control that. But all the exercises and real development is around developing youth. How do we develop those eyes as a youngster? How do we get them into a normality, or how do we get them as an advanced? So sports science right now and ocular sports science, Shera Calder worked with the Sharks. That was all vision orientated. How do we increase our peripheral vision and how do we use those parts? But it wasn't preventing health. It wasn't preventing sight loss or anything. It was more about enhancing what you have rather than preventing loss of anything. What you have.
I see it. It's always that thing. I think as humans, we always want to try not get to the worst possible point as opposed to sometimes thinking, how am I just going to optimize how I am in general? When it comes to nutrition, and it's the thing we're talking about holistically, people sometimes want to spot eat, and I'm going to eat vitamin A, and that's going to kind of help me, so I'll just like carrots, and then everything else I can maybe let go to the wayside. Is there a certain diet that's kind of approved for optimal eye health, or is it just trying to make sure that you're eating all your macros, getting all your macros in your body and moving around, and just generally being a well human?
I think, like you said, people want to prevent, but it's what you do when you're young. So people often say, when I'm older, I will do. When I'm older, I will do. So the thing is trying to be young, trying to engage in health at a younger age. So start with antioxidants, which is great for the eyes. But again, antioxidants are recommended in higher doses if you have macular degeneration. But where did the macular degeneration come from in the first? People talk about like vegetables and stuff, and the joke is, have you ever seen a bunny with glasses?
Yeah.
And then someone will bring up...
My mom tells that joke, so...
Hopefully,
it's a very age-specific. It's like a very age-specific joke. Yeah.
So those particular vitamins and minerals and that sort of stuff, they can help. So people with dry eye, you can look at vitamin A, vitamin E, omega-3. Those things can help, right? And how you ingest them. Like omega-3, we used to think it was oil, but we actually now found that omega-3 has an anti-inflammatory response along the meibomian glands, which helps with the oils. So, like, there are little things, but in general, like for the eyes to be sufficient, you need a low inflammatory process. So anti-inflammatory diets are really good, probably for the world, but anti-inflammatory diets are good. And then after that is that how you're engaging with your systemic health. How are you putting health and cultural eating together? How are you putting health and exercise and all those sort of things? Because you can eat really healthy, but if you're not exercising, you can eat really healthy, but you're not controlling your circadian rhythm in terms of how you're sleeping and that sort of stuff. There's a combination of holistic health, which is what you say. So you can't just target just nutrition.
Just one,
But systemic health, so diabetes, high blood pressure, all those things which you can engage, or cholesterol, which you can engage in healthy diets and lifestyle changes. Those things are also preventative for ocular health problems.
Yeah. So it is generally what we always say: live as well as you can. we are in the time of kind of your phone and social media, and people start talking about kind of the blue light and how that could potentially be detrimental to your eyesight, and how that also affects you systemically because it affects melatonin and circadian rhythm and everything else. When it comes to things like digital kind of fatigue or the computer vision syndrome, where people are talking about dry eyes and the fact that their eyes hurt, head hurts, what are your thoughts around that? And if you could just kind of explain in as layman's term as you can, the concept of blue light and how that affects you systemically.
So blue light is not necessarily blue light. It's any digital light, like the lights that are here in the studio and that sort of stuff, that messes with the body's ability to see night and day. So it's not the blue light that's in the sky. That's actually really healthy for you, as I look up at the blue sky in Durban. But like the real engagement is digital light messing with the system where the body doesn't know when to switch off. So the blue light impacts us. So it impacts us in a way which we can't control that circadian rhythm. If you've ever seen Erling Haaland, he's got those massive orange ones. You know, that's proper blue blocking. But he's blocking himself from every digital light that's coming at him. So it's not just his cell phone, it's not just his phone. So there is a controversial point. So there's research always fighting. So blue blockers for computers and all that sort of stuff. There is a fight where it's saying it's going to prevent macular degeneration, which is negative. It's all where the light is landing. That they're trying to protect. But if you go look at some of the research, there'll be arguments that it's causing worse vision in kids, it's causing worse change to the eyes, it decreases contrast sensitivity, increases leaning forward posture, which then leads to neck pain and head pain. You know, so there are negative things. But the one thing that I can definitely say is that it helps with, and anecdotally, so research that we've sort of seen and engaged over the years, is that it definitely helps with sleep patterns. So people that are struggling with sleep patterns, that have heavy marketing jobs or heavy digital jobs or accountants or heavy lighting wherever they are, you know, that does help with the sleep pattern. The problem is it does alter color, so white is not white, it's like brown. So if, for example, if you're a graphic designer, it's a hard thing to do because, hey, it is red, and then the client's like, no, it's not. You know, but it's take your glasses off, oh, okay, and then you see the color change. But the thing with it is that it is controversial and people have different beliefs in it, but the one thing that I strongly believe that it does is help with sleeping patterns. So there are a few software development companies around the area here, and I said to the guys, hey, can I have 5 or 6 guys that are battling to sleep? Can I have guys that are having good sleep? I want to just try something. And the thing around it was, it's not when you're wearing it just during the day. During the day you can do what you want because that's normal rhythm. But when you come into night and you go to Netflix and TV and laptops and gaming, like lots of guys game, and that's all, like you're playing Call of Duty, it's a strong light. You're really focused on the light, so the brain's not getting that chance.
Yeah, exactly. And the melatonin's supposed to be rising to allow you to kind of start winding down and that kind of stimulation. Exactly.
100%. So and that's why Kindle also focused on like having a white back book. They could have come and they could have made it a strong white color like an iPad, but they didn't. They try to keep a natural pad because that actually helps with the reading quality. So they did the same thing, and then books are always great. You know, a lot of guys will say, I can read and then go to sleep. You don't hear many people say, well, I watch my series on my pad and then I pass out. I
binged it, and all of a sudden it just made me feel calm and relaxed.
Yeah,
exactly.
A lot of the people that do watch TV sort of habitually for anti-stress and that sort of stuff will actually like, they're playing something that they know, so they lose focus on the TV and then they'll fall asleep. They're not fixated on this interesting movie. Whereas if you're reading the book, you can still then close it and then sort of turn off and go to sleep.
And then in terms of the people you were helping who were having difficulty sleeping within those businesses, did they actually come back and say they started to feel like they were sleeping better quality sleep?
So it was before Blue Control came out, or Blue, your phones, like iPhones, they can switch into a dark mode, which like changes the color to a browner color. So it was before that was around. But what we did is we did that. So the one guy was getting like 0 sleep. He got sort of 3 or 4 hours, which was great. The other guy was getting 6. He got up to 8. And then the other guy that was getting decent sleep got better sleep. And then through the different people, some people said no response. But in that one guy that was noticeable, he wasn't getting, and he had struggled for sleep for years.
Because 0 is a crazy number to have.
So people have insomnia for different reasons, you know. So again, it can be PTSD or other psychological stuff. But he specifically was since I've started working, I've struggled to sleep, and that was the interesting chat. Was that he put the glasses on and he said, look, this helped. Whether placebo effect, no placebo effect, as always, but he definitely had a much better quality of sleep after that. So I was grateful that, like, that's for me, it's helpful.
Of course.
We're doing something that's aiding this guy to better his lifestyle, and I think that's where that blue control is. If it can aid your lifestyle,
and it doesn't do any harm as well. That's always the big thing when it comes to any sort of management.
100%.
And I think with how we're moving and in the era that we live in and the amount we engage with screens, phone, computers, whatever it is, it's always something to be mindful of when it comes to humans and how we're built and just biologically, that sleep is a cornerstone for any 100%. Sort of health optimization. You can be the fittest, lowest body percentage, everything else is hinged on your body's ability to then regulate itself within that 24-hour cycle. So I think it's something to take home. It's a big nugget, and we always are trying to make sure you guys are connecting the dots. Speaking of fast fire questions, I usually ask people questions out of the blue and kind of off left field, but for today, I feel like I would love to know some of the myths that you've heard that you want to quickly dispel for people at home, because I'm very interested. Like, everything that you said to me now is things that I've kind of read around, and hearing it from you and how you kind of speak about it, it almost clicks into place quite fluidly. What are some of the biggest myths you've heard and you just quickly want to dispel, especially to the people who are watching?
I think the biggest myth, first of all, is like the way that I see the world is the way that I see the world. Like that is the first one. People don't understand that their vision could be better.
Can I tell you what's crazy about that? I have a colleague, he is finishing his specializing time. He said that he grew up and he used to walk around and he thought life was like just what it was. And then somebody once said, hey, why aren't you seeing that there's like a couple of dots that are there? And he was like, oh, okay. Anyway, it leads down to at about the age of 8 getting glasses. And he said, grass has blades.
Yeah.
Like there's
trees have leaves.
Actually, yeah, he's like,
No,
leaves.
trees
He was like,
have
it just
leaves.
used to kind of be this murky thing where it was like green, but it was just like this blobby kind of look. And that's what you're saying to me every time somebody says that. I'm like, wow.
I think the two craziest stories for me about that is one was a little girl. She came in, she got her eyes tested, and when I say little, 12, 13 years old, she put on the glasses, she walked outside, and she said, people's faces have wrinkles? Like, and I was like, you can't say that. Like, it was the first thing, it was quite funny. And then the second one, which was quite heartwarming, there was this 36-year-old guy, and like he had burn marks and stuff on his face and stuff, and I asked him, like, what do? You do your case history? He said, I'm a baker, and I said, like, but why? He says, no, I have to go really close to the instruments to see it, and like that like pops up your ears. And he had never had an eye test before, and it was a minus 19. So if you take 100 divided by 19, so what's that, like 5 centimeters, 4 centimeters, whatever, in front of his face, that's as far as he could see. So because it was so bad and had never been treated, he had lost that one eye. So we put the contact lens on, and he walked out, because you don't really get glasses up to minus 19, so put the contact lens on and he walked outside, and his girlfriend was in front of him. And like, you know those things like where you hear for the first time, where you see color for the first time. It was one like where he could actually perceive what was in front of him for the first time. And like it took a bit of space for spatial perception and stuff, and he just started to cry. Like, and that's when like he just started crying, and he realized, okay, this is what I've been missing my whole life. And I'm like 35 years old.
That's...
You know, and that for me is like, it's just also, it's just community awareness. Someone says probably when he was working, he can't study, he's useless. Like 60% of, I think the stat was like 60% of disability through eye is preventable just by giving glasses. So that's why like there was Vision 2020 and ICEE and Brian Holding Institute and Isidore, which are all these projects trying to like increase community awareness of eye health. But just to notice, you say like, well, maybe this kid can't pass because they can't see.
Yeah.
I had one that was like, they sent him to a remedial school, and they came through, and like I checked their eyes, and I was like, well, this and this and this and this. Now she's in normal school, writing normal exams, and like living her life, you know. And that myth that like glasses make the eyes worse, you know.
That's
it's the glasses.
If you put them on, then your eyes are just going to get worse as time goes on.
And it's rather naivety. So it's the naivety of what the world actually looks like. You know, that older person that we call it short arm syndrome, like when the arm just starts creeping out and they want to fight it and they want to fight it. But I can't read the menu. The menu font has gotten smaller.
I'm sure everybody at home knows that person who's just like, no, when did they start changing the font size and the...
Well, the best is I had a patient the other day saying, no, I just asked my child to read it. Like, if I can't see it, I just ask my child to read it.
Outsourcing.
I was like, well, they're going to leave you at 18. And then you're kind of stuck. But yeah, just that, and then they think it's the glasses, but there's natural aging, there's natural norms and that sort of stuff. So I think that's where optometry let ourselves down, was the myopia control, but now we're correcting. You just didn't know. Like, it's like going back to World War II and saying, why did more people survive? Well, now we knew what bacteria was.
Yeah.
Well, now saying, what's plastic surgery, or what's this, or what's that? We just didn't know. So I think that thing of knowing and growing our knowledge, again, that myth that everything is as we see it is probably the biggest one. I don't know, is there any other myths that you can think of that
you know what? And this is more just me being aware, because we always have people sitting down here, and I can always tell when something resonates, because I know I love health for a whole host of reasons, but I'm somebody who's always wanted to optimize myself. I've always wanted to kind of understand for myself, so I always relate things very closely to me, and you are very passionate about the things that you're talking about, not just from an academic, this is what the New England Journal of Medicine kind of says. And for me, it's a question of why optometry?
For myself, it's always a tough question, but first of all, I can't see. So, so introduction to optometry came through the fact that I couldn't see, and I was fortunate enough to be able to see. So the first thing was the introduction. Me personally, I was registered for business science finance, and I wanted to do medicine, and sometimes you need a certain amount of marks to do medicine. And I didn't get in, so about a week before, they said, hey, there's this opening in optometry. I see you had applied. I'd been overseas playing sport at that stage, and they said, well, are you coming back? Do you want to take up the spot? And I was like, I think God opened this door, so let me walk through it. So on a spiritual journey, I walked through it, and the major points that I like, and you feel value, and like if you come into my practice, I hold value. You know, walking and selling a pair of glasses maybe in a retail shop would be different, but holding value in your industry, and holding respect, and then just being able to help community. Like, everything about my life is generally set up about how can I help people, how can I advance. Like, friendship circles are how can you best feed off me, and how can I best feed off you, and that's the type of care I try to give my patients. What is the best optical experience that I can give you, and how can I best enhance your life? And I think that's when I walked into that field, I kind of got that ability. Optometry itself has a high turnover rate in terms of people moving on to other degrees, because it can be boring. And I found that the love of people is what's kept me there, and
it's
what's kept me going.
The same thing when it comes to me too. Like, there's that resonance, especially with the human condition, and you can help people in so many ways if you have a skill set. But like, the main thing for me, and clearly it sounds like it's the same thing for you, the main thing is people. You're saying you can't see. Can you? So I don't have wrinkles to you. I'm flawless right now. I look like a pristine. Am I smooth?
I've got my contacts in.
I was about to say, like,
but we can work on some editing. And
okay. Because I was thinking maybe you're seeing me with a filter, and I was just like a smooth face. Luke, man, thank you so much for sitting down with us. You are clearly a wealth of knowledge, and you have a heart that's helping you change other people's lives. I hope all of you at home have also taken nuggets, because I've taken a whole bunch. I'm going to go back, and when I see patients and I see people, it's going to be a whole different experience when it comes to referring them to optometrists, for them to get better eye care. So it is the month for eyes, and we're hoping that you're going to be looking after your eyes a lot better after hearing all of that. It is another incredible episode of Medshield Movement Connect show with me, Dr. Fez. Catch you on the next one. Keep your eyes open. Medshield Medical Scheme focuses on restoring confidence in tomorrow and encouraging peace of mind for all South Africans, with 9 medical aid plans designed for every budget and phase of life. To get a quote, visit www.medshield.co.za.